The hallmark difference between irreversible and reversible cell injury is membrane damage. So when he slaps you slowly, he has not damaged your membranes. So till the time membrane damage doesn't occur, it is a reversible cell injury. It will be reversible. But once he slaps you or beats you to hell that your membranes are damaged, now you become enemies. You say, I am no more friends with this person. So remember, so one key point, one key difference between reversible and irreversible injury is membrane damage. So membrane damage is not present in reversible cell injury. Membrane damage is present in irreversible cell injury. That's the first point that you should remember. Now coming to the second option, that is cell size. So remember, cell size of all the organelles will be increased. Mitochondria will be increased, endoplasmic reticulum will be dilated, okay, and lysosomes will be dilated, but the membranes will always be intact. Now, can you tell me one organelle which when distends, the two subunits get separated? That is ribosomes, you know. So, ribosomes has 40S and 60S unit. It dilates, but when it dilates, the two subunits get separated. So, when the two subunits get separated, automatically the protein synthesis decreases and the compensatory fatty change starts. So, whenever I am talking about reversible injury, remember the size of each organelle increases. Whereas an irreversible injury, if it is necrosis, if it progresses to necrosis, the cell size will increase, whereas if it is apoptosis, the cell size will decrease, okay. Now, that's about the sizes. Now, coming to the third point is nucleus. Coming to the nucleus. In the nucleus, chromatin is very, very important. Whenever there is a reversible cell injury, it causes mild condensation of chromatin. So, there is mild condensation of chromatin. Whereas, in irreversible injury, there is marked chromatin condensation such that it becomes like a dot, okay, that's called pycnosis. And then this nucleus will fragment, that is called as karyorhexis, and then it will dissolute, that's called karyolysis. So, that's the nuclear changes which we are having. So, once we are clear with the nuclear changes, okay, now coming to the third important thing that we have to remember. So, we have discussed about the size of the cell, we have talked about the nucleus, now comes the cytoplasm. So, in the cytoplasm, you know, whenever the cell is distending, cell is enlarging in reversible cell injury, some amount of the plasma protein from the membranes will fall in the cytoplasm. They will distend and fall in the cytoplasm. These are called as myelin figures. What are they called as? Myelin figures. Whereas in irreversible cell injury, whenever we talk about these plasma proteins are breaking again and falling in the cytoplasm, but there are extensive number of these myelin figures. So, there are many myelin figures. So, the number of myelin figures are very less in the cytoplasm of reversible cell injury, whereas in irreversible there are lots and lots of myelin figures. So, remember what's the difference between reversible and irreversible then? So, start from the basic. Reversible can be reversed, irreversible cannot be reversed. Come with the size of the organelles. So, all the organelles are distended except the ribosomes which get separated, and so fatty change starts. Irreversible, depending upon the type, if it goes to apoptosis, the size is going to become smaller. If it gets necrosis, the cell size is going to become bigger. Coming to the nucleus, the chromatin here condenses mildly. There it is marked condensation. The last that you go is the cytoplasm. So, there are mild myelin figures here. There are extensive myelin figures in the irreversible cell injury. That's the difference between reversible and irreversible cell injury. Is everybody clear with this? Yes? Okay.